Good morning, everyone. Welcome to another wonderful episode here, John's Podiatry. Just presenting a case that was performed yesterday by Dr. Hugo Fernandez. As everyone knows, we cannot video anything in the operating room, so I'll go ahead and present this case. This is a pleasant patient who presented to us with an ulceration to the side of the ankle. Okay, we had presented this case originally as well. And basically, even though we were definitely making some progress, this patient originally, several months ago, it had a very, very large defect on the side of the leg over here. And, historically, we essentially implemented the same treatment. We applied an external fixator, which is exactly what everyone sees, also known as the cage. The cage. So there's one ring, and these external fixators, believe it or not, are very lightweight. They don't weigh a lot. That's the beauty. In addition to that, believe it or not, the patient can actually walk on it. In this particular case, we knew already what worked for the patient. When the patient originally had the other ulceration, the goal was to provide dynamic stability. In other words, have the ankle not move up and down, because any movement was detrimental to the healing of the ulcer. The patient subsequently developed this ulcer as well. And even though it was getting better, it was off the timeline, right? When we look at an ulcer and we look at the time that it's taken to heal, it was off the bell curve, so to speak. So we decided to reapply, right? Let's now reinvent the wheel. Let's implement what we already know, what works for the patient. So Dr. Fernandez applied a split thickness skin graft, which was harvested from the own patient. Applied it to the ulceration. Okay. And then the external fixator was applied to prevent any motion. There were two limiting factors here, right? Number one, the location of the ulcer, and number two, the movement. So we stopped all that, allowing, right? This will allow the ulcer to heal in a timely fashion, a lot quicker. Let me show you guys another view. This is the bottom view, okay? So again, this is what it looks like, okay? And as everyone can tell, you have all these pins that are going through the foot, and that's what provides the stability. The foot cannot move this way, or up and down. And as everyone can see, you have these half rings, so to speak, the foot plates. I'm not gonna throw too many complex terms, but let me show you guys the side view. So the idea is to keep the foot at a 90-degree position, right? To make sure that the ulcer's on the other side of the ankle, to make sure that we keep the foot and the ankle in that 90-degree position so that the split thickness skin graft will take. We're going to leave on the external fixator until the ulcer heals, hopefully sooner than later. But, these are, when we talk about limb salvage, these are treatments very advanced treatments that we implement. Something as simple as movement, right? Something as simple as movement can be the most detrimental factor to the healing of an ulcer. If anyone is wondering, wow, that's really aggressive or over-aggressive, it's not. Our job is to heal ulcers. We are the healers. So we will do whatever it takes to make sure that the ulcer heals, period. I'll show you guys this view one more time. Right? So, and again, this is Dr. Fernandez, who applied the external fixator. Lightweight, provides, in this particular case, it's providing no movement. And as everyone can tell, the pins are holding everything in place. This is through the two bones, the tibia, the fibula. There's other pins here behind this. You guys can't see it, and here. The patient's lower extremity is essentially stuck for the next several weeks until the ulcer heals. Like always, www.jawspodiatry.com, Instagram, Dr. Tojam, Facebook, Jaws Podiatry, and last but not least, our Jaws Healthcare YouTube channel. Like always, thank you for watching.